and our medical officer of health, and Paul Johnson, the city's Emergency Operations Center Director. And over the weekend, our local COVID enforcement team was joined by the provincial inspectors from the Ministry of Labor. Ministry of Labor was focused on big box stores, and they made about 162 visits and saw issues related to health screening, safety plans, and capacity concerns. So details on this weekend blitz will be available from the province later this week. Beginning next week through the rest of February, these media briefings will be held on Tuesday afternoon at 4 p.m. And in March, we will return to our regular scheduled time slot of Mondays at 3 p.m. And lastly, I'll remind everyone once again about the provincial stay-at-home orders and essential trips. Hamilton will remain under the stay-at-home order until at least February the 11th, 2021. And during this time, residents are asked not to leave their homes unless it's for essential purposes or activities. Those activities include going to the grocery store or pharmacy to get your medical needs, accessing healthcare services. Please do continue to do that. Exercising as much as you can. Outdoors would be great. And for work, where the work cannot be done remotely. So COVID-19, the virus is still very active in our community. We must do our part to stop the spread by avoiding unnecessary contact with those that don't live in our household. That includes family members that don't live in our household, friends that don't live in our households, and coworkers that don't live in our households. Not kosher to have them into your home. Is it vitally important for everyone in our community to stay vigilant and continue following the guidelines? Yes, it is. And those restrictions are set out by the province of Ontario. And your actions make a difference and could possibly save a life. So do your part, trust the experts, continue to follow all recommendations from our public health team, and stay at home as much as you can. I'm going to turn it over to our director, Paul Johnson, for some local updates on the Emergency Operations Center. Paul?
Thank you very much, Mr. Mayor. A few things to touch on today. First, from an enforcement perspective, you'll know that both the province of Ontario and, of course, our own local bylaw enforcement folks are out regularly, ensuring that there is compliance with the provincial orders and any local bylaws that are related to COVID-19. You'll note on the website that a number of businesses appear on our website from the last week. Again, there are key things that are lacking in those cases are the failure to conduct the health screenings, which is really important, that people are paused before they enter the store and that they answer a series of questions. And I know that it's another piece of layering on of work, but this is really critical to keeping people safe. The other pieces are around not having safety plans posted and face covering violations. And face coverings these days are very important that they're proper face coverings worn in the proper way. Continue to see some residents charged. They don't appear on our website as named individuals, but there are gatherings that continue to be hosted. In the last 7 days, we had an engagement party with 15 guests that was hosted as well. And just a reminder that you'll sometimes see obstruction charges are laid both when it comes to businesses or individuals. And just to let you know, here's a great example. We had one homeowner who opened the door, said yes, they had people over, closed the door on our bylaw officers and would not talk to the officers. This is the definition of an obstruction charge. And you can't just ignore the bylaw officers when they arrive. They do have the right to be there based on information that they receive. So again, people are doing a great job for the most part, but we're encouraging everybody to be as close to perfect as they can be with all of these measures. And Dr. Richardson and I had a conversation today, actually talking about this very thing. I think people understand mask wearing, keeping distance, all the rest, the proper setup of physical barriers and things. And now it's really pivoting to this next period of time is going to be about doing all of that perfectly and to perfection so that we can stop the spread. Toboggan hills are open in operation now that we've had a bit of snow. We have 4 official toboggan hills at the city of Hamilton. One is at the Shadoke Golf Course, another at Kings Forest Golf Course, Waterdam Memorial Park, and the reservoir at Garth and Stone Church. Please, if you arrive and the tobogganing hills are a little crowded and you can't maintain that distancing from other people who aren't within your own household, and you just feel like there's a few too many people, come back later, choose to do a different activity. They're open from dawn to dusk. Please vacate as it gets close to the end of the day. We don't want the midnight tobogganing and all the rest happening. And please wear a mask. There have been some clarifications sought about parking and whether we would be relaxing or eliminating the restrictions on on-street parking. And at this present time, it's business as usual around our parking regulations. However, our parking staff, as always, are focusing their efforts on issues and infractions that pose a health and safety concern. We're all now looking at the things that really matter at the moment, but in terms of whether we're going to set aside the parking rules for a period of time, the answer to that is no. In terms of a service that we are going to start to offer again starting tomorrow, we will have a appointment-based only access to marriage licenses. This is something that we did stop when the full lockdown and stay-at-home order happened. And one of the rationales for that was that it really wasn't essential for our staff to be in those locations. But we have had a number of questions, and it is one of the services that cannot be entirely done online. And so in order to support people who have marriages coming up while we're still in this lockdown stay-at-home area, by phoning us at the City of Hamilton and asking to book an appointment for a marriage license, you can do that. And the in-person part of that will be very short. We're going to ask you to do a lot of the online work that you can in advance and arrive with everything ready to go, and we'll do the in-person piece as quickly as we can. I must have a stated marriage date before April 1st. That date will continue to be reviewed and pushed out as if we stay in lockdown much longer, but we're not interested now in people coming for appointments if marriages are happening beyond April 1st. They're valid for 90 days. We're not going to be issuing refunds for those licenses if your marriage doesn't proceed within 90 days. So just a reminder around that. And civil marriage ceremonies remain unavailable at the city. So if you need the license, phone us. 546-CITY is the number, 2489, 546-2489, and you can book your appointment for that. Last thing I just wanted to address, because we again have had some questions and people looking forward to getting back to normal at some point, and a big part of normal is events. And I'll say at this point, the city is not setting a date for when in-person events can start to be booked. And through our city process, we're going to be obviously following the advice from the province and following the advice from Dr. Richardson about when we can start to get back into that piece. So we're not going to start to set, we think it'll happen now, we think it will happen now. We're going to be waiting a little bit longer. Our advice is that if you're planning larger scale in-person events for 2021, you should do that with caution, particularly if you are going to expend any money or other resources on those events. None of us can fully predict, despite what you might read in the media or hear online. Nobody can predict when we'll be able to do some of these events in the way that they've normally been done. So if there are ways that you can do it virtually or a little bit differently, and you're happy to go ahead with starting to think about the planning, go for it. But just exercise some caution around that. The City of Hamilton itself is not investing operational resources at all at the moment for our in-person events at 2021. We'll only start doing that when we have a better line of sight as to when those events will start. So we're all anxious to get back to those types of activities. But again, just a bit of advice to those who run these events and organize these events, because I know the energy, the time, and the money that's put into even the planning of these events. Exercise some caution, because as much as we would love it, Dr. Richardson does not have that full crystal ball that she can gaze into and say, here's when those events can absolutely start up in earnest again. We're just going to have to wait as this year progresses. Thanks, and over to you, Dr. Richardson.
Thanks very much, Paul. I certainly do wish I had the crystal ball that could tell us when we were going to go forward with so many of these things, but unfortunately, no. Today, we're standing at 9,238 cases in total here in Hamilton, which is 55 new cases from yesterday. And in case that does lead you to start looking at your crystal ball and thinking, well, the numbers are coming down, we should be able to get back to a few of these things, I'll tell you that our weekly incidence per 100,000 is sitting at 84. And just a reminder, these are the sorts of numbers at which we're on the upswing in December, when lots of people were saying, shouldn't we really be getting into lockdown because these numbers are so high? So just remember that perspective. These are still quite high numbers. We're very glad to see them come down. Very thankful for that. And today we have a total of 46 local outbreaks, which is below our peak of 53, but still a very high number. And we want to see those continue to come down. here in Hamilton. So we very much need the control measures that are in place. We need them to work very well. We are concerned about the variants of concern that we've heard about, the UK variant, South African, and of course know that the UK variant is present here in Ontario. We've heard from Public Health Ontario that it's considered that there is community transmission of that variant here in Ontario. And so this is a time where we have to do things nearly perfectly, as Paul has said, in order to keep the numbers down, keep transmission low, and save lives. We do have a couple of updates today just around the vaccines. So as you know, there's been a challenge in terms of Pfizer's vaccine supply for Ontario. And so the vaccine program has had to slow down very much. So as of yesterday, we're just over the 19,200 vaccine doses administered, about 4,800 of those through the mobile site and about 14,400 through the fixed site clinic at HHS. Our mobile clinic was able to start yesterday to do second doses in residents of long-term care and high-risk retirement homes, going back to Idlewild Manor, which was the first one to be vaccinated. And then today they're at St. Peter's and at Hamilton Continuing Care. So for our residents in long-term care homes and high-risk retirement homes, they are sticking with that 21 to 27-day interval for booking clinics for Pfizer and 28-day interval for Moderna. The fixed site clinic, we're still on pause there. They are going to be rebooking appointments for people who are going to get their second dose through that clinic, and that's the same people who got vaccinated there the first time will get vaccinated there again this time. Those recipients are going to be scheduled for their second dose within the 42-day timeline that the province has put forward and are working towards reopening on February the 10th. You may have already taken a look at our website, and our preliminary COVID-19 vaccine data is now posted there on www.hamilton.ca/coronavirus. The data includes the total doses administered and total doses administered by clinic site. We know that's just a beginning of the vaccine data that we would like to be able to provide. Unfortunately, the system doesn't yet give us the ability to pull more data. And as it does become available, then we'll be able to post additional information. But at this point, that's what we're able to post. And hopefully we'll expand it soon. We'll hear from the province more about that, I'm sure, over the coming weeks. Back to you, Mr. Mayor.
Thank you, Dr. Richardson. And let me just take this opportunity to once again reinforce the message that we must stop this virus to save lives, protect our most vulnerable, and to protect our economy so that we can get back to some semblance of economy when this is behind us. But that's going to be a while yet. And so remember, support your local businesses safely by shopping online for delivery or curbside pickup. All of that is possible. Residents are doing their part by only going out for essentials and staying home as much as possible, which I know for many folks is extremely difficult. So if you or someone you know is struggling, please reach out for help. Call COAST at 905-972-8338 or Kids Help Phone at 1-800-668-6868. You can also visit our website, which is a number of agencies and partner organizations who can help individuals at hamilton.ca/COVID mental health. So don't give up. We can, and we will overcome this, but let's help each other get through this. I'm going to turn it over now to Jasmine for some media questions. Jasmine?
Great, thank you, Mr. Mayor. We have 5 media on the phone today. We'll start with Kate McCullough from the Hamilton Spectator. Kate, you can go ahead.
Hi, everyone. Thanks so much for taking my questions. My question today is for Dr. Richardson regarding Hamilton's return to the classroom. In today's education announcement, Dr. Williams said local medical officers of health need to be satisfied that it's safe for students to return to in-person learning and have the appropriate plans in place to facilitate that. With that date being a week away, can you give us a sense of where Hamilton is at now, and maybe what is the local threshold for public health to consider supporting the reopening of schools here? And are we in that ballpark yet?
Thanks, Kate. We don't have a specific threshold in terms of reopening. We have been working all through this time along with our local school boards, waiting for word about when things may reopen, whether they're going to go back to school, and working with the schools to make sure that they are ready to reopen with the new measures in place. That there's validation of the secondary student screening, that as you know, there's already mask wearing here from grade 1 through to grade 12. So that was already in place, but making sure they're ready for the outdoor masking that has been recommended as well. And sorting all those pieces through. As you know, there's also some asymptomatic testing. The province has made available some 25,000 PCR tests as well as rapid antigen tests for use. And so we're talking with the school boards and others about, whether that's something that we would see could be useful here locally. So we're still working on those measures, and we'll be talking through more with the province in terms of specific reopening. We do know, I think it's really important to continue to stress that kids do best when they're back in school, and we know that schools do need to reopen, and we're following that principle of last to close, first to reopen as part of this. So once we're satisfied that we can move forward, we'll be doing so.
Thanks. My second question, you sort of started to answer there about voluntary asymptomatic testing of students and staff. And I just wonder if you could expand a little bit more on what the Hamilton School Board should be expecting in terms of testing in schools, and maybe just tell me a little bit about public health's role in this new voluntary testing.
Thanks, Kate. It's, this particular testing, it's a bit of a challenge because it does take a lot of resources to do this testing. And so the government has been working to find ways that it can be done without using the resources of either the school boards or public health in order to help facilitate that. It's also not any sort of replacement for when people are actually sick. We need to make sure that they go and get diagnostic testing done through the appropriate assessment centers to make sure that they get the best test in terms of finding that diagnosis out. So we're still trying to understand exactly how we might use it, how it could help us here in Hamilton. And so we've had some partners from both McMaster University and the hospitals, as well as the school boards. We've been dialoguing to look at where it might be something that is either looked at from more an understanding of transmission perspective, or how it might be used here. So we haven't settled on that yet, but are working on it.
Thank you, Dr. Richardson. Next question will be to Maria from the Hamilton Spectator. Maria, you can go ahead.
Hi there. I wanted to ask Dr. Richardson, we noticed that Grace Villa is back in outbreak today, and there were still active cases when it was declared over. So I was wanting to ask if it's safe to assume that it's a continuation of that outbreak, or if you can speak to that a little bit.
Thanks, Maria. At this particular time, it is a single staff person who has tested positive. And our criteria for declaring the outbreak over is that we've had a sufficient time with no new cases onset. So people, unfortunately, sometimes do have longer courses of illness. That's not the criteria for declaring it over necessarily, but indeed to make sure that there are no new cases that are happening. So with a single case, we're very hopeful that, as many other places have had, there's been just one or perhaps two cases, and that's all there is to an outbreak. We do know that this is a place that had a number of issues beforehand, before their last outbreak, and of course during their outbreak. And there's been a lot of partners who've come to the table: the Ministry of Health and long-term care, the hospitals have come in to help them, the local health integration network, home and community care, as well as ourselves. And so we're very helpful that the supports and the learning that went on during that time are going to pay dividends right now and make sure that there's no further transmission.
Thank you. And my follow-up question is with respect to rapid antigen testing for local long-term care homes. Is there any news on that front, on when that might roll out?
So that was also a directive that came from the province in terms of rolling that piece out. So the long-term care homes should be actively working on that now. They were given some dispensation if they were in active outbreak to wait until that had been completed to start the testing, which makes a lot of sense. Because again, we know it's a rather resource-intensive initiative, and they need those resources during the outbreak to be managing the outbreak.
Thanks, Dr. Richardson. Next question will be to Joanna from the Hamilton Spectator. Joanna, you can go ahead.
Hi, thanks so much for taking my question. My first question is for Dr. Richardson. Last week at this briefing, you talked about pressing the province to help with and I'm looking to find out what you think about the fact that only one inspection happened over the Grace Villa outbreak from the province, and that inspection found nothing amiss and didn't provide any corrections.
Hi, sorry about that, Joanna. You faded out in the first part of the question. Could you ask that again?
Yeah, sorry about that. Can you hear me now? Hopefully.
Yes, Joanna, go ahead.
Okay, so last week you talked about pressing the province for help with Grace Villa to go in and help out with that home. I'm looking to find out what you think about the fact that there was only one inspection done by the province over the course of that outbreak, and that inspection found nothing and made no corrections.
Thanks very much, Joanna. My recollection is that there may have been more than one inspection. I'd have to go back and review with staff exactly what happened over the course of that piece. Suffice to say, we were very concerned from the outset, knowing that there had been challenges with this home previously, and that's why we were very quick to review with the province, bring them on board, make sure they were aware of the things that we were seeing with our inspections and the concerns we had, as well as just, the villa itself was expressing a need for staff, for supports in order to move forward. And so that's where our congregate settings table is so valuable at the Hamilton COVID response table, where all of the partners come together, the hospitals, home and community care, to talk about what supports can be brought to bear in cases such as that. So there were a lot of partners working on that one, and a lot of information that was shared in order to support them. And then ultimately it is up to the Ministry of Long-Term Care and Ministry of Health to look at what they need to do in order to ensure resident care in these institutions.
Thanks so much. And I think my next question is also for you, Dr. Richardson. Local public health units are being asked to put plans in place to prepare for the return to the classroom. And also the province announced funding for PPE. So I'm looking to find out more details about Hamilton's plan for a safe return to school and how this PPE will be allocated.
Thanks so much, Joanna. And as you know, we often get information at the same time that you're getting information as we go forward in terms of exactly what the province is planning in terms of guidance and in terms of the resources that they're able to share. So there has been discussions, as I was talking about earlier, with the school boards about what return to school could look like, about some of the things we'd like to see put in place. You've seen now from the province that they're also looking at increased screening in secondary school students, that they're looking at mandatory masking down to that grade 1 level. You've seen the pieces about the concerns that have been raised before and after school around making sure that kids don't congregate at schools before and after school. You've seen the concerns about outdoors. So these are all things that we've been talking about at the table with our schools in terms of how they move forward, what practically speaking could be ways that those sorts of things get put into place. So we'll be continuing to work with the school boards over the coming week or so to prepare for reopening.
Great, thank you, Dr. Richardson. Next question will be to Katrina from the Hamilton Spectator. Katrina, you can go ahead.
Thanks very much. Both of my questions are for Dr. Richardson. So in terms of our travel related cases, I know we haven't had very many in Hamilton throughout the whole pandemic and not very many recently, but I'm wondering, of the cases that we are seeing, have any been connected to like holiday travel? Like, are the cases that we're seeing now from people who went abroad or left Canada during the holidays?
Thanks, Katrina. I know you're working with Jack and she's working with Dr. Harvey on some more details for the questions you've been asking around those pieces. Unfortunately, we do continue to see some travel-related cases. They are almost entirely international travel related, although the numbers still are small. I think we've only had a single case that has been about interprovincial travel, but the definition for travel was changed in the case and contact management system by the province. And so now it is strictly related to interprovincial and international travel.
Okay, thank you. And then my second question, I'm wondering if public health is tracking people who are called long haulers. So people who are seeing symptoms, long after they, the 2-week period of symptom onset. And if yes, what can you tell us about those cases?
Thanks, Katrina. In the case of people who may continue to have symptoms, it really does depend on what sort of level of symptoms they may have. So for those who are, resolving but may continue to have some symptoms, there is a threshold at which we say you're moving on your way to getting better. You're no longer considered infectious. You're not acutely very ill, and so those ones, the ones that meet those criteria, we don't continue to track over time, although they may continue to experience some symptoms related to their infection. For those that are acutely ill, and some of the examples are those of the people who are in a hospital and have prolonged hospital stays or ICU stays, those would be ones where we would be aware of them being in hospital and how long they're in the hospital for. But no, just sort of overall, are we tracking that longer term piece? No, we're not.
Great, thank you, Dr. Richardson. Next question will be to Matt Ingram from CHCH. Matt, you can go ahead.
Hi there, thanks for taking my question. I was wondering, my first question I believe is for Dr. Richardson. Just wondering, with the history of the situation at Grace Villa, have you in public health already kind of talked about at what point, if this next outbreak stirs up, you would consider reissuing that order? I know Hamilton Health Sciences is in there on a voluntary management agreement, but at what point would you ask them to be there in an official capacity from Hamilton Public Health?
So when we look at these situations, there's sort of different tools that we can use in an outbreak where things are concerned. So if it's an issue that's particularly about infection control issues, disease control issues, then we'll usually use a Section 22 order in order to ask the facility to take more steps related to the outbreak. If we're seeing sort of a broader issue where the home doesn't appear to be able to manage the outbreak, that's when we would step up to a Section 29.2 order. And so you can sort of think of them as a tiered response in a way. And then once you get to an ongoing issue where there seems to be something that's needed over the longer term, that's where, when we're working with our colleagues with Ministry of Long-Term Care and our colleagues at Retirement Home Regulatory Authority, then they can impose these voluntary management orders or mandatory management orders. So if you think of it in that way, we wouldn't step back to a 29.2 because that's essentially what the voluntary management order is already doing in terms of addressing those issues. If we did see some additional issues around infection control, we might consider that. But if you've already got a voluntary management order in place, you're pretty much working with the experts to make sure that those changes are put in place. So we wouldn't expect to have to go forward with another order. But of course, when all of these outbreaks, we're continuing to monitor the situation, communicate amongst the partners and the parties that are involved. And if we think more is needed, then we work together to make sure that happens.
And my follow-up, I guess that's what I'm trying to get at. Like, given the history, would you escalate the situation right from the start? Not look at it as a fresh outbreak, but look at it as a potential continuation of what was going on before.
So in terms of escalating it, if we think about it in terms of how we're managing the outbreak, we manage them all as a group, each time they start. And so we bring together the players, and then we raise further concerns and escalate the kinds of interventions that we use. So we would, with this premise, just as the others, we would be very much on it together as a group to say, okay, what's happening? Is there anything more that's needed? So yes, in that way, it escalates kind of more quickly in organizations where we know they've had a history of challenges in dealing with things in the past or with COVID-19 in particular.
Thank you.
So we have a bit more time. We'll go through again for one more question each. We'll start with Kate McCullough. Kate, if you'd like another question, you can go ahead.
Sure, I'll take that question. Again, a question for you, Dr. Richardson, and again about return to school. I just wonder, I wanted to clarify. So in the provincial announcement today, it really sounded like the province was putting some of the onus on local medical officers of health around the return to classroom. And I just wonder if you could clarify your role and Hamilton Public Health's role in the decision-making process around the reopening of schools, just to make sure that I understand that correctly.
Thanks very much, Kate. I think, as we moved forward through the time period over December, the chief MOH came out to talk with the medical officers and ask them about, schools and the impacts in schools and what was happening there, and to gain advice, to formulate his own opinion and advice to government around what should happen there. And as he's been going through and making decisions about what goes forward, he's done the same. He's come out, he's spoken with us about what is needed, and in the areas where they have lower rates of transmission and have been able to go forward earlier than we have. So my anticipation is we'll continue to have that dialogue with the province around where we go from here. And at the same time, we'll be working with our school boards very closely to talk about what they need as they prepare to reopen.
Great, thanks, Dr. Richardson. We'll go back to Maria from the Hamilton Spectator. Maria, you can go ahead if you'd like another question.
Hi, thank you so much. I was wondering, Dr. Richardson, so you mentioned a number of partners that were involved at Grace Villa, and that the villa itself was expressing a need. So I was wondering if you can speak to what do you consider an adequate staff level at that home in terms of staff-resident ratios? And did Grace Villa ever reach that level during its outbreak? Because I know that even once the hospital was brought in, there were challenges about around people, like members of the hospital staff, getting COVID as well.
Thanks, Maria. I think it's really important to understand the different roles that each of the partners plays around the table. So our role is to look at infectious disease control and infection control practices, and to look at whether the facility is able to do the things that need to be done to control the spread of disease. Sorry. So one of those things, of course, is they need to have the staff to do that work. And so, in conversation with the premise, we talked to them about, do they have stuff in place? How do they feel about it? Are they able to do the things that need to be done, like screening staff when they come in, doing checks with the residents in terms of their wellness? And if they are expressing any concern around that, we would raise that with others at the congregate settings table and with the ministry to say there are concerns that are being raised, and we're concerned that the work that needs to be done isn't getting done. And so we don't formally assess the staffing levels per se. That's not our area of expertise. We don't run long-term care homes within public health services. We aren't geriatricians or geriatric nurses. We rely on the experts who do that work and the inspectors with the province to make those assessments and to determine what is needed from a clinical perspective. And so our job is to make sure that the infectious disease control work, the infection control work is being done, and where staffing issues seem to be getting in the way of doing that, to raise that with the appropriate people.
Great, thank you, Dr. Richardson. Next question, we'll go back to Joanna from the Hamilton Spectator. Joanna, you can go ahead.
Hi, thanks so much for the extra question. Mine is for Dr. Richardson. Dr. Richardson, I was looking to find out where we are when it comes to what you recommend for masks, because we're hearing a lot about, are cloth masks good enough still? Do you need to wear 2 cloth masks? Do you need medical masks? Like, what do you recommend for the public right now?
Thanks, Joanna. And we know that over the course of this pandemic, masks have been one of the things that have been probably the more confusing aspects of control and what's recommended, with WHO having made some recommendations, with the Public Health Agency of Canada having made recommendations along the way, and it continues on with people, organizations continuing to come forward with recommendations about what they feel is best. So we work with Public Health Ontario, who've just done a recent review, have issued their guidance as to what they think is required. And so we'll continue to work with them and the recommendations that they have made. And it really comes back down to what Paul said earlier. This is about doing things pretty much perfectly. And so, wearing a mask that fits well, it should be a mask. It needs to not have air gaping around the sides. It needs to be covering your nose, mouth, and chin. All of those things are really critical as we go forward. And so PHO has some good guidance on that, which is a good place to find it. But this, following that pretty much to a T, is what everybody needs to do as we go forward.
Great, thank you, Dr. Richardson. Next question will be to Katrina from the Hamilton Spectator. Katrina, you can go ahead.
Thank you. My question's for Paul. I'm wondering, we're seeing a lot of people skating on the ice at Coots Paradise, and I'm just wondering if this is something bylaw is keeping an eye on in terms of too many people congregating in one space, and also what the city is recommending about the safety of being on the ice right now.
So in terms of bylaw, they're always aware of where gatherings are, and so certainly they're out there in a variety of settings. If it looks like it's too many people, they can attend there and try and encourage people to be, and I guess enforce if they needed to in terms of the numbers. But that's a pretty large area and things are spread out. I mean, obviously, if it is safe to be on the ice, and I'm not one to pass judgment on the safety of actually being on that ice, but if it's safe to be out and doing those types of things, as happens in the winter time, then our advice is very clear. It's consider wearing a mask if it's more than just you out there, because that will keep you from even those moments of coming within 2 meters of somebody, which can happen when you're out there. And the other piece is the same advice we've been giving since the start of this. If you go somewhere and it's just a little bit busier than in your heart of hearts, it really should be in terms of your participation, just go somewhere else. But in terms of the actual safety of being on that ice surface, I'd have to, I think that's the conservation authorities to do, and others. You got to be safe about those types of surfaces and make sure that it's safe for people to be on. But I don't have advice on that front. But in terms of if it is safe to be on, just keep the numbers down, keep the mask on, and keep your distance.
Great, thank you, Paul. Next question to Matt Ingram from CHCH. Matt, if you would like another question, you can go ahead.
Hey, thanks so much. Yeah, absolutely. I always appreciate an extra question. This one's for Paul. You had mentioned in your remarks that case of obstruction where the man just kind of closed the door in people's faces. I realize you can't speak about individuals who are breaking the bylaw, but it does raise for me some curiousness about how much pushback you're receiving from people when you go out and do these enforcements. Is it obstruction charges something that you're laying a lot of them on individual residents at these private parties that you're breaking up? I guess I'm just trying to understand a bit about what your bylaw officers are encountering when they go to do enforcements like these.
Yeah, so given all that we do, it's not a regular occurrence. It does occur both in the business setting where we've had people obstruct us getting into. This is generally not the bigger areas, but we've had some small businesses that have. So, obstruction orders are low. I'm looking here under the emergency measures piece is about 9, and under the Reopening Ontario Act, it's 2. So we don't have a ton of obstruction things that come our way, which is good news. And what I think I'm trying to illustrate is though that don't. People, you'll get all these myths. Well, if I close the door and they can't come in, then they can't charge me. Well, we actually have a charge that takes care of that, and it's called obstruction. So the reality is, if we do attend, it's in private residence, as I've said before, this is not a proactive piece. We're not sending bylaw officers to a street, knocking on every door and poking our heads in. This is because somebody has sent something our way. These are reactive in nature. And you know what? I say this, and I smile when I say it, because, unless you live really isolated from anyone else, recognize if you have 15 people coming for an engagement party, the likelihood of your neighbors recognizing that and maybe making a phone call is pretty high. And then we're going to attend and there. So if you don't care about the health and safety element of it, just recognize that people are out because everybody's affected by this and impacted by it. People don't like people breaking the rules. And in all likelihood, we're going to get a call. And if we're available, we're going to attend and lay those charges. It is in those environments that we've seen this spread happen. And this is, us really trying to make sure that we don't just have another cluster of cases now that Dr. Richardson and her team have to look at simply because people said, well, you know what, it's really important we have this engagement party. It's simply not. And at this point, we have to put other things like the health and safety of ourselves and others ahead of, boy, wouldn't it be nice to, boy, wouldn't it be nice to. And that's what we're asking everybody to do. So it's not something we see often, which is great. Illustrated it one other time around what businesses do sometimes to block us from coming in and doing our work. And in this case, it was actually an individual that tried to do that in terms of our work. We have things that can happen when that occurs, and we will take those actions and lay those charges. But thankfully, people are pretty accommodating and recognize that we're there to do the job. And the other piece of good news, the mayor and Dr. Richardson and I talk about this a lot, is that Hamilton is doing a great job. And what we do is illustrate that, you know, just in those moments where you get sentimental and emotional, because we're all at that stage, and say, well, you know, can we just have that real milestone gathering, and we'll keep it small. It might have been a 40-person engagement party, and we'll keep it to 15. The answer right now is there is no number that's acceptable. There's no number that's allowed from an indoor perspective in terms of people who aren't with your household. But it's also on all of us just to play this out over the coming months. And we really always hope that it's about compliance rather than enforcement. We don't have enough officers, and quite frankly, that won't get us to the point that we need to be at. It will be all of us just doing the right thing.
Great, thank you, Paul. Mr. Mayor, that's the end of our media questions for today, so I'll pass things back to you.
Thank you, Jasmine, and thank you to the media partners for your questions. And just to reiterate what Paul Johnson just said, I mean, the rules apply to everyone for all the right reasons. We're trying to prevent the spread of this virus and potentially costing more lives. So it applies to everyone, not just a select few. And I can fully understand that those that aren't following the rules, and you know, others that want to call and let us know that that's happening. You know, I fully understand that when they're trying so hard to be helpful and cooperative and sacrificing just like everyone else. When someone isn't prepared to do that, that certainly is worthy of a call, and we certainly don't discourage people from doing that. So thanks to those that have continued to do the good work. And as Paula mentioned, the vast majority of our population is really, really working hard on this, and we really appreciate it. If you know someone that is having you know, difficulties coping through this process, and you know, it's okay to not be okay. There are some assistances for you. Well, we mentioned those earlier, some mental health supports that you can access, and you can get information on not only that, but anything else relative to vaccines or the supports that are available for people out there and generally, and for businesses. You can go to hamilton.ca/coronavirus. You'll get a lot of accurate information in there in terms of what kind of things are available to you to give you those supports that you need. And if you haven't yet done this, download the COVID Alert app on your phone, on your smartphone. It is a great way for you to be aware should you have come into contact with someone that was COVID positive. That will certainly be a key indicator for you that you might want to get a test and get a check. And so please do that if you haven't done so already. The COVID Alert app is on Google Play or on the App Store. You can get them on your smartphone. Continue to work together. Don't give up. We are working collectively to get through this, and we'll just remind you that our next media briefing will be on Tuesday, February the 9th at 3 p.m. We'll see you then, if not before. Thank you all. Good afternoon.